Teens in England will be getting just one HPV shot this fall. England is the latest country to drop the number of required doses for the highly effective HPV vaccine. The World Health Organization announced last year that a single dose offers solid protection against HPV. Ireland, Scotland, Wales, and Australia have all made the switch so far, and Canada has not. For more on this, we are joined once again by Dr. Isaac Bogosh. He's an infectious diseases specialist at Toronto General Hospital. Good morning, Dr. Bogosh.
Morning, Chris.
All right, so let's start with whether you think Canada should consider lowering to a single dose, and what are the perceived benefits of that?
So, you know what, I think it's not entirely clear. There is some decent data emerging that a single dose of the 2-dose HPV vaccine provides very solid protection. How much better than 2 doses is it? And the real question, though, is how much better is it over a long period of time? We know HPV, of course, can cause cancer, not just cervical cancer, but also other types of cancer. For example, many cancers of the head and neck. We know it takes years and years, sometimes decades, from the time that a person is infected to the time cancer develops. So it's not entirely clear how much better 2 doses is versus 1, or if that's the case, over a long period of time. Now, lots of these public health agencies are looking at the existing data. We've clearly seen some places have gone to 1 dose. The key is, if you take that choice to go to a single dose, you have to have fantastic surveillance to really ensure that that's the right approach. Or maybe if it isn't the right approach, if there is actual benefit of that second dose, provide boosters to those who had a single dose when that policy was rolled out.
And Dr. Bogosh, there are changes to cervical cancer screening for women underway in Canada that could help detect high-risk precancerous infections. What can you tell us about that?
Yeah, it's really interesting. So many countries have moved from the traditional Pap test to an HPV test. Now, the traditional Pap test, of course, is there's a speculum inserted, there's a brush that takes a sample of cells from the cervix, and a cytopathologist looks at those cells, and they can see if the cells are normal or if there's precancerous cells or cancerous cells there. It's a very important screening tool for cervical cancer. What's happening is many provinces are mulling over changing to what's known as an HPV test. So instead of taking a sample of cells, they take a sample, and the real change is in the laboratory. They do PCR testing for HPV, or human papillomavirus. So that's, you can detect the virus and see if the virus is there well before there's actual changes to cells, well before you see precancerous changes or cancerous changes. So some countries have already switched over to that. We'll likely see this happen in Canada. It's probably a more sensitive way for screening. It relies on a lab, a PCR test, not a human, to look at cells under a microscope. It may even be more cost effective. And it's likely better for people who have received a previous HPV vaccine. I'd still remind people that for the many people that might have not received an HPV vaccine, it does appear that the Pap test is still likely the preferred test, or at least that's up for debate, because you do still see those precancerous or potentially cancerous cells that are there.
And maybe you've already answered this, but if you could just clarify, because this is such critical information for women making healthcare decisions at key points in their age. Does the HPV test have higher sensitivity than the Pap test?
It's based on some of the results that have come out. It does appear to have higher sensitivity, which is obviously fantastic. But remember, that detects whether the virus is present. And the traditional Pap test actually looks at cells, so you can actually see under the microscope if there are precancerous or cancerous cells, whereas the Pap test, the HPV test, looks to see if the human papillomavirus is present. And just taking a big step back, remember, there are hundreds of types of human papillomavirus. It's pretty ubiquitous. And a few of the types of human papillomavirus that are around can lead to cancer over a longer period of time. And a few of the types of human papillomavirus can lead to warts, like genital warts, for example. So what the vaccine does is really targets most, not all, but most of the cancer-causing and wart-causing human papillomavirus strains, and that's why it's so important to get this vaccine. And it's done a remarkable job. I mean, rates of cervical cancer have plummeted in areas that have rolled out the HPV vaccine. So I think the key points here are, yes, there might be changes to screening. Yes, there's pros and cons for each type of screening. But the key point is that HPV vaccine is extremely effective for cervical cancer, but likely also for other cancers, including cancers of the head and neck.
And Dr. Bogosh, for those looking for guidance, depending on where they are, can you give me a sense of where provinces stand on this?
Yeah, this is probably going to take months, in some places even years. So different provinces are at different paces of either rolling out HPV testing in lieu of Pap testing. And, it's not something that you can just snap your finger and do overnight. You have to have the laboratory capacity to do it. You have to obviously train frontline healthcare providers that do these tests. There's a lot that goes into it. You also have to evaluate the existing data and determine if this is a direction that you're willing to go in. I really do think this is the way forward, and I think that many provinces are going to pivot in that direction. I wouldn't be surprised if we start to see this rolling out in months and in some places years to come.
All right. We always appreciate your insights. Dr. Isaac Bogosh joining us from Toronto.